Eyewitness News with more medical coverage now. Flu season is approaching, and that means time to get your flu shot. Joining us now with the information you need to know about flu shots and flu prevention, Dr. Jeremy Blais, a pharmacist with CVS. Good morning. Thanks for coming in.
Morning. Thanks for having me.
So we got one at home right now with the sniffles and a little fever, so I don't think it's the flu, but it's already that time of year. Kids back in school. It's like little petri dishes at their classrooms. So what do we need to know about the upcoming flu season?
The most important thing for people to know is that the flu shot is the most effective way to keep you and your family healthy. So there's a lot of things that we can do. Washing your hands, obviously, especially if you have kids. Right. Not touching your hands or to your face or your mouth. But the most effective way to keep you and your family healthy is with a flu shot.
And as far as the strains, and does it match this one? People sometimes skeptical because they think, well, I'm not going to get it because I got it last year and I ended up getting sick. So it's not foolproof, but it is the best prevention possible, right?
Absolutely. So the main shot that we use is called quadrivalent, which just means it has 4 different strains of the virus that are in there. So they do research every year to determine what is the most likely strain to be out there. And even if it isn't the exact match for the strain, it does give you some immunity, so it does protect you.
Is there any specific time that you should get it? Is it too late to get it at some point throughout the year? Because I still see the signs up. Most people get it, say, in late, summer, maybe early fall. And there's signs still out in front of CVS, like in February, that say, get your flu shot. And some people might think, well, it might be too late. Is it ever too late to get it?
It's never too late. Even if you already had the flu, there's different strains that are out there, so you do want to make sure you protect yourself. But it is important to start early. So it's not too early now either. We hear that a lot of times from patients. It takes your body up to 2 weeks to get immune. So if you got a shot now, when the flu season started October 1st, you're already covered and you're prepared for the season.
What about kids and the mist versus the shot? What's more effective? Are they both the same? I know people read different things and they sometimes say, well, I don't think it's worth it to get the mist because my kid was sick last year anyway. Doesn't matter the age, those sort of things, with the different types of flu vaccinations.
So they're both effective. The important thing to know for kids is that they have to be at least 6 months old before they get protected. But that 6 month to 5 year window is really where they're most vulnerable, where the flu could turn into something more intense or land them in the hospital or something like that. So we don't want that, obviously.
And is there a difference between the effectiveness between the mist and the shot? Or I know some kids don't. You don't have is there a choice that you can have if you're a child?
There are choices that are out there. There's different data out there in terms of what's the most effective option, but that would be something to refer to your pediatrician for.
All right, final question is about insurance. I know a lot of folks want to know how is it covered, what is it covered, what do I do if I just go to a CVS and I want to get the flu shot?
So this has been great, actually. A lot of insurers have come around in the last couple of years and started covering it at pharmacies, which has been great from a convenience standpoint.
Right.
Most insurances do cover with small copays or no copays if that's the case. If it's not covered, it is $39.99. However, in Rhode Island, we do have some state-supplied vaccine to help patients who might not be able to afford it. So that's a great option as well, available at CVS or at the doctor's office.
All right, doctor, thanks so much for coming in.
Thank you. Appreciate it. Thank you so much.
Helpful advice. And if you want to know more about this topic, of course, you can go to our website and you can see this entire interview in its entirety. I just said that twice. It's on WPRI.com.